Hi everyone, welcome to part one of our two-part webinar series on the SSI and CalFresh expansion. My name is Jacqueline Hess. I'm the CalFresh Program Manager at San Diego Hunger Coalition. With the SSI and CalFresh expansion in effect as of June 1st, 2019, we'd like to share some background info on SSI, how this affects CalFresh eligibility, the role of Social Security Administration, and how to maximize deductions to increase the monthly CalFresh benefit allotment. First, I'll begin with some background info. As most of you know, Supplemental Security Income is a federally funded safety net program administered by Social Security Administration. It provides a very basic income to older adults and people with disabilities with little to no income or resources. This chart shows the monthly payment amounts for single SSI recipients and couples. As you can see, individuals receive between $930 and $988 a month, which means they are living at 90% of the federal poverty level. In 1974, the federal government began its SSI program. California chose to link SSI and CalFresh to reduce administrative burden. The initial benefit amount for food back in 1974 was $10 a month, and that amount has not changed. As of this year, SSI recipients still only receive $10, and their monthly SSI allotment has not increased along with cost of living adjustments. This means that many Californians are living below the poverty level, struggling to meet their basic needs, and having to make tough choices between paying for housing, medicine, and food. San Diego Hunger Coalition participated with Californians for SSI, which launched a 5-year advocacy campaign to increase the SSI amount and to expand eligibility for CalFresh to SSI recipients. This went into effect on June 1st, meaning SSI recipients can now apply. Looking at San Diego County, we have the second largest SSI population in the state of California, right behind LA. There are 95,000 individuals receiving SSI. This map shows the concentration in Central, East County, and South Bay, but is also dispersed across the county. Looking at the demographics specifically to San Diego, about 67% of SSI recipients have some form of disability, and about 57% are over the age of 60, with some overlap between the two populations. We highlight this because the majority of these individuals will need additional support to apply for CalFresh. They may experience barriers and not know about their eligibility for the CalFresh program or how to apply. Now let's take a look at CalFresh eligibility. As you know, CalFresh eligibility depends on the number of people in the household, their combined monthly income, and expenses. Not all SSI recipients will be eligible for CalFresh. However, the vast majority will be. We divided these potential eligibility scenarios into 3 categories. So if customers come in to ask questions about their eligibility and whether or not they should apply, you will have the basic information. An important note and a question that's come up often: receiving CalFresh will not reduce their monthly SSI payment. If they qualify for and begin receiving CalFresh, the benefits are not counted as income. Now let's take a look at the eligibility scenarios. This is the first eligibility scenario. SSI recipients living alone or with another person not currently receiving CalFresh should definitely apply. They are the most likely eligible and are encouraged to apply. The vast majority of SSI recipients will fall into this category. The second eligibility scenario: SSI recipients living in households with multiple people not currently receiving SSI or CalFresh may be eligible based on their household circumstances and income. They should consider applying for CalFresh. In San Diego, there are about 10,000 SSI recipients living in a household already receiving CalFresh. These individuals will be automatically enrolled at the household's next semi-annual report or recertification. When the SSI recipient is added to the household, their SSI income is also counted, which could impact the amount of benefits the household receives. It is incredibly important for these households to keep up with their reporting, and here's why. California created 2 new state-funded food programs for households negatively impacted by this program change: the Supplemental Nutrition Benefits, SNB, and Transitional Nutrition Benefits, TNB. The SNB program will provide supplemental state-funded nutrition benefits to CalFresh households that experience a reduction in CalFresh benefits when the SSI recipient is added to the household. The Transitional Nutrition Benefit Program, TNB, will provide transitional state-funded nutrition benefits to CalFresh households that experience the loss of CalFresh eligibility when the SSI recipient is added to the household. In sum, if a household sees a reduction in CalFresh benefits, they are eligible for SNB. If a household loses CalFresh eligibility, they may be eligible for TNB. The most important note: in order to remain eligible for SNB or TNB, the household must keep up with reporting. Although it's important for all households to keep up with CalFresh reporting, if households receiving SNB or TNB lose eligibility, they cannot reapply and will have permanently lost the state-funded benefits. SSI recipients who are currently residents of institutions where they receive 51% or more of their meals from the institution are ineligible for CalFresh, unless they are living in a federally subsidized housing for the elderly, in a drug and alcohol treatment rehabilitation program, individuals who are blind or disabled and in a group living arrangement, temporarily residing in a shelter for battered persons, in a shelter for the homeless. If this applies to you and your organization, you can read more in the All-County letter. Now let's take a look at Social Security Administration's role in assisting SSI recipients with applying for CalFresh. Since SSI is administered by SSA, they will jointly process some CalFresh applications to assist during the implementation. SSA will only assist the following: households that are conducting business with SSA, such as applying or recertifying for SSI, households that only include SSI applicants or recipients, SSI applicants and recipients that are not already receiving CalFresh. Households with both SSI and non-SSI members will be referred to getcalfresh.org or to a county office. SSA technicians will screen these households for CalFresh and assist if interested in completing and submitting an application. This can be done in person at the SSA office via paper application or online or over the phone. The SSA technician can electronically sign on behalf of the household and will submit within 1 business day. New CalFresh applicants will not be required to complete an interview. The county may still call to get additional information from the customers if needed, but it will not be for an interview. Applicants that appear to be eligible for emergency expedited CalFresh benefits will be referred to the nearest county office. SSI recipients are automatically eligible for the Elderly Simplified Application Project certification periods. We'll talk more about the certification periods in the context of this expansion next. Newly eligible households that apply between June 1st and November 30th, 2019 will be assigned a shortened certification period than usual. This is to account for the influx of new cases. Usually, households with an elderly and/or disabled household member are certified for 24 months. They will now see varying certification periods between 19 to 23 months. ESAP households with only elderly and/or disabled members and no earned income are normally certified for 36 months. They will see shortened certification periods of 31 to 35 months. Again, this temporary exception is to support program administration, since we expect a large influx of applications initially and during certifications. These new households would usually recertify at the same time, which would cause another influx of recertifications 2 and 3 years out from initial implementation. This is a one-time exception. Households that continue to be eligible will transition to the maximum certification period afterwards. The county will assign shortened certification periods based on the last digit of the household's case number. These will be staggered between 19 and 35 months from the time of initial implementation to ensure timely process of certifications, since we're going to be seeing an influx due to these newly eligible populations. For example, a newly eligible household with SSI recipients and no earned income usually is eligible for a 36-month certification period. They apply between June 1st and November 30th. The household's case number ends in 7. They will be assigned a 32-month certification period. This is important for organizations helping individuals recertify and maintain their benefits. As mentioned, and a very important note to remember, households receiving SNB or TNB that miss their reports or recertifications could lose those benefits permanently. Your clients may be returning for help earlier than anticipated due to their abbreviated certification periods. This may also make it harder to set recertification reminders without knowing their case number, and you may need to answer questions from community members with varying certification periods. Let's move on to verifying income and maximizing deductions. SSI recipients can obtain their income verifications online, over the phone, and in person. To request an award letter online, they can log in to Social Security Administration's online portal. SSI recipients can also call a toll-free number to request the letter and will receive via postal mail. They can also request a copy at their SSA office. To find a local SSA office, you can use their locator link. SSI recipients are automatically eligible for Medi-Cal. It is always worth listing the medical expenses to maximize possible benefits the clients are eligible for. Allowable expenses include health insurance premiums, including Medicaid, Medi-Cal, hospitalization or outpatient treatment, dental and eye care, including dentures, eyeglasses, and contact lenses, obtaining and maintaining service animals, including cost of food and vet bills, transportation needed to obtain medical treatment, attendant or health aid, the cost of attendant services and home health aides, including any meals provided, prescription drugs and costs of medical supplies, as well as outstanding medical bills. Over-the-counter medications can be considered an allowable expense when approved by a qualified physician. For example, if a doctor recommends Tylenol twice a day, the customer can submit record of their patient history that includes the doctor's recommendation, along with the receipt from their local pharmacy or store. Child care or adult care not covered by Medi-Cal Medicare can be deducted. There's no cap on the child adult care deduction. No additional verification of expenses are required. There's also no maximum excess shelter deduction for seniors and individuals with disabilities. Since there is no cap on child or adult care or the excess shelter deduction, maximizing all of these will help to increase the monthly benefit allotment. For more information about SSI, California Department of Social Services has posted their outreach toolkit. This includes flyers, posters, brochures, and webinars surrounding the SSI and CalFresh expansion. Translated outreach materials are available in Spanish, Russian, Cantonese, and Vietnamese languages. The San Diego Hunger Coalition launched an SSI landing page. There is a client-facing page that includes basic information and ways to apply for CalFresh. Our partner page includes outreach materials, checklists, and training resources, and additional information on maximizing deductions. We hope that you enjoyed the presentation. Stay tuned for part 2 that will go into more detail about SNB and TNB. For additional questions, please feel free to reach out to me, Jacqueline Hess, or Amanda Schultz-Brochu, Senior Director of Programs. Thanks, everyone. Enjoy the rest of your day.